regulates the movement of sugar into cells or doesn't produce enough insulin to maintain a normal glucose level. As a result, instead of fueling our cells, sugar builds up in the bloodstream. Now you might wonder, what are some of the signs and symptoms? Well, they're often subtle and may develop slowly. You might experience increased thirst and frequent urination, increased hunger, weight loss, and fatigue. In some cases, you might also see areas of darkened skin, usually in the armpits and neck. Risk factors for type 2 diabetes are numerous. Being overweight or obese tops the list, but also age plays a significant role. The risk increases as you get older, particularly after age 45. However, the tide is turning and we're seeing an increase in younger adults, teens, and even children developing the condition. A family history of diabetes, particularly from a parent or sibling, can increase your risk. Physical inactivity, high blood pressure, abnormal cholesterol and triglyceride levels, and certain other factors also contribute to the risk profile. It's important to note that having pre-diabetes also raises the risk of developing type 2 diabetes. Pre-diabetes means your blood sugar is higher than normal, but not high enough yet to be classified as diabetes. So how does type 2 diabetes affect the body? Over time, the high blood sugar levels can damage nerves and blood vessels, leading to complications like heart disease, stroke, kidney disease, eye problems, dental disease, nerve damage, and foot problems. While type 2 diabetes is a serious condition, it can be prevented or managed through lifestyle changes and medication. Remember, early detection and treatment can have a significant impact on preventing the onset of complications. So, take care of your health, because your body is the most priceless possession that you'll ever have. Wondering how to prevent type 2 diabetes? Here are some steps you can take. Firstly, maintaining a healthy weight is crucial. It's worth noting that losing just 5 to 10% of your body weight can significantly reduce the risk of developing type 2 diabetes. This is because carrying excess weight, particularly in the abdominal area, increases the body's resistance to insulin, leading to higher blood sugar levels. Regular exercise is also pivotal in preventing type 2 diabetes. Physical activity not only helps to maintain a healthy weight, but also improves the body's sensitivity to insulin. Whether it's a brisk walk, a swim, or a bike ride, aim for at least 30 minutes of moderate intensity exercise on most days of the week. Following a healthy diet is another key step in prevention. Consuming a balanced diet rich in fruits, vegetables, whole grains, lean protein, and healthy fats can help maintain a healthy weight and improve insulin sensitivity. It's also advisable to limit processed foods and beverages high in sugar. For those who smoke, quitting can significantly reduce the risk of developing type 2 diabetes. Smoking not only increases insulin resistance, but also leads to a host of other health problems. If you're finding it hard to quit, seek help from healthcare professionals. They can provide resources and guidance to make the process easier. Lastly, it's important to limit alcohol consumption. While moderate alcohol consumption may not directly lead to type 2 diabetes, excessive drinking can result in weight gain, which is a risk factor for the disease. Aim to have several alcohol-free days each week and avoid binge drinking. In conclusion, preventing type 2 diabetes involves making consistent lifestyle changes. It may seem daunting at first, but remember, even small changes can make a significant difference. Whether it's swapping a sugary drink for water, taking a short walk after dinner, or trying a new vegetable, each step brings you closer to a healthier life. Remember, preventing type 2 diabetes starts with small, consistent changes to your lifestyle. If you've been diagnosed with diabetes, don't panic. There are several ways to manage this condition. Managing diabetes means maintaining healthy blood glucose levels, which requires a combination of approaches that tackle your diet, physical activity, and possibly medication. Let's start with lifestyle changes. Diet and exercise play